Now, we've been talking a lot today about the easing of lockdown restrictions in some countries, and many of those same countries are making the wearing of face masks compulsory. Let's bring in Ross Atkins on the issue. Hi Ross, you've been looking into this for us.
Hi Babita, yes, I think face masks are very much going to become part of many of our lives now, in particular those countries where lockdowns are being lifted. Now, some countries have even passed laws making it illegal to leave the house without a mask. Spain's taking a gentler approach. Not everyone has to wear one, but if you're in Spain and you want to take public transport, you won't be allowed to get on without one. This was the underground in Madrid this morning, and as you can see, Red Cross workers have been handing out masks to people who may need one. And this was Brussels. Similar rules in place. Police were stopping anyone without a mask and making them cover up. Well, we know France is to follow with similar rules when its lockdown is eased next Monday, and the UK may also be following suit soon. Remember what Boris Johnson said at the end of last week?
What I certainly agree with is that as part of coming out of the lockdown, I do think that face coverings will be useful, both for epidemiological reasons, but also for giving people confidence that they can go back to work.
Now, for those of you watching in Europe, wearing a face mask is likely to be a new experience. That's much less the case for those of you watching in Asia, where masks are much more common. Here's Vincent Nee from the BBC World Service.
You might wonder why so many people in Asia wear face coverings. In Hong Kong, Taipei, and Tokyo, people wear face masks when going about their business. Historians say the customs of wearing face masks began in Japan in the early 20th century, but more recently, outbreaks of infectious diseases such as SARS in 2003 encouraged people to cover their faces in public. Now, it is not always easy and comfortable to wear face cover in public, especially in warm weather, but over time, people just get used to it. There's no clear evidence, however, in Asia that face masks stop the virus from being transmitted between humans, but many believe they will reduce the risks of catching the disease, and that's why, since COVID-19 was first reported in China late last year, we have seen even more people in Asia wearing face masks.
That may be the perception, but actually the science is a little bit different. Wearing masks is primarily advised because they're designed to stop people potentially spreading the virus. It is also, in some cases, there to protect the individual. And on that second point, some people say, well, look, we don't want to do it. They say they don't want to protect themselves. And this has become a feature of protests against lockdown measures, particularly in the US. You may well have seen this image. It's been widely shared online. The sign reads, "My body, my choice." And as I'm sure you know, that's a slogan that's long been used in the abortion debate. This protester, though, is in Texas and is obviously trying to use it to make a very different point. The thing is, though, that face masks aren't really there to protect the wearer. Scientists, including the UK's Royal Society, say the main purpose of face covering is to stop anyone who has the virus from spreading it to others. Well, let's hear from Eleanor Murray, an assistant professor of public health at Boston University. Here she is on what the mask can and can't do to stop the virus.
The scientific research on the use of masks for the general public to stop the spread of infectious disease is a little bit mixed, but mostly because we haven't really had a good opportunity or reason to study this question in the past. Evidence that we do have does suggest that individuals who are infectious when they wear a mask can reduce their transmission to other people. We also know that people with SARS-CoV-2 can be infectious before they start to show symptoms, and so this is why it might be a good idea for the general public to wear masks. It's important to remember that a mask doesn't substitute for staying a good distance apart from other people, and that a mask, once it's up against your face, is now a potential surface for contamination. So you want to make sure to wash your hands well before and after putting on or taking off your mask, to put on or take off your mask only by using the straps or elastics and not by touching the face part. And don't adjust your mask using the face piece of the mask while you're wearing it. Once you've put it on, try to leave it alone and don't touch it until you're ready to take it off for the day. When you're finished using your cloth mask for the day, you want to make sure to wash it in warm, soapy water, and this will be a good way to clean that mask and make sure that any infectious particles on the mask are destroyed before the next time you use it.
Ellie also had some advice for anyone wondering what sort of mask to wear. Well, to stop spreading the virus to others, a homemade one, made out of an old t-shirt, for instance, she says will work fine. But for protecting yourself from catching it, and particularly for anyone working in healthcare, obviously, that's when you need a more sophisticated, properly produced mask to make sure it's keeping you safe. And with that, it's back to you, Babita.
Charles, thank you very much.